A running stitch is an efficient stitch to become comfortable with because it's rapid, probably 2 to 3 times faster than simple interrupted sutures. And this can be used in areas where there isn't too much strain, such as the scalp. That's probably the most usual or most frequently used area. Now, it's essentially starting the same as a simple stitch. Both sides of the needle down, a wide bite is taken, exiting at approximately the same distance on the other side of the wound. So far this is the same as a simple interrupted suture. It's then tied the same way. But instead of cutting the end, you now continue, entering the same distance that you plan on each side of the wound, but exiting a little bit distal from the beginning stitch. And now you come directly across from that exit, enter here, angle to the other side, same distance apart again from between here and here. Again, enter directly across, exit angled, across the other side. And as you can see, this pulls the wound together very nicely, and it is very fast and efficient. Then enter directly across, and at the end of the wound, you exit, and this is where you tie. Pull it snug, but not too tight, and you're actually going to use the loop as the end of the suture to tie. So you go around twice, grab the end of the loop, and you tie like this. Again, approximately 4 times. And you have a nicely, rapidly sutured wound. Now, one of the problems with this is if an infection occurs, then people are concerned that the whole sutured laceration has to be dehisced in order to do that. But in actuality, if this was actually this long, it is possible, if there was an infection just in this area, simply to remove, by cutting this area, remove this, remove perhaps half of this, allow the infection to be relieved here, and then steri-strip down the little remaining area of stitch, or even pull it through a bit more here, and steri-strip this here. Works very well, especially if this was 2 times longer.